Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, a reminder that if you'd like to ask a question, you can click the Raise Your Hand button. When you're called upon, we will unmute your microphone, and then you will have to unmute your own microphone. Thank you.
I know it's Good Friday, but let me just say to everyone who is joining us today, afternoon. And I say that because just like the city of Indianapolis, the state of Indiana lost a member of our family yesterday when Officer Brianne Leith was senselessly taken from us in the line of duty. Officer Leith, before working alongside her brothers and sisters at the IMPD here in Indianapolis, also worked for the state of Indiana, the Department of Corrections, for 2 years. She oversaw the We Ones program, where, in her words, she said she learned as much from them as they learned from her. I will tell you, before that service, before wearing that uniform, she also wore the uniform in the Indiana National Guard, where she served there for a few years before she was honorably discharged as a specialist. And that is an apt word to describe her. She was special by any definition of the word. She was someone who was a role model. She was someone who folks her junior or senior looked up to. And we will miss her, and we are keeping her family and her friends in our hearts. Her family also serves the state of Indiana. This is the best among us, and we're saddened by this tragic event, and we will find a way to honor her appropriately in the days ahead. With that, Dr. Box, I know you have some updates for us on a more global or statewide scale, if you'd be so kind to share.
Yeah, thank you, Governor. Today, unfortunately, we reported 55 new deaths. 46 of them have occurred in the past 7 days. Unfortunately, we've now reached 300 deaths in the state of Indiana. We've also been notified that 24 residents of the Bethany Point long-term care facility in Madison County have now died in total. 16 of these individuals had tested positive for COVID-19, and the other 8 had symptoms compatible with COVID-19. This is a tragedy for the families. It's a tragedy for the healthcare staff that grew close to these residents. It's a tragedy for our entire state. And that is why we continue to expand our strike teams and send them into long-term care facilities all across the state. Many of you have been asking for a breakdown in cases and in deaths by race and ethnicity. We'll be adding that information to our dashboard on Monday, but I can share it with you today that 18.5% of our cases have been among our African American population, compared with nearly 50% among our white population. About 3% of our cases were among our Hispanic population. Unfortunately, the ethnicity part of this is missing about 57% of the data. When we look at deaths, we found that a little over 19.2% occurred among our African American population, while 69% were among our white Hoosiers and a little under 2% among our Hispanic residents. These disparities among our African American population mirror what we see with other health metrics that we know to be significant risk factors for death with the COVID-19 disease, and that is diabetes and heart disease. I have a few other updates for you involving our drive-through clinics and our ventilator and ICU bed capacity and the volunteer healthcare workforce. In 2 days, we tested more than 500 people in our drive-through clinic in Maryville, and will be in Lake County until early next week. We'll also be launching drive-through clinics in Clark, Vanderburgh, and Allen counties to test symptomatic healthcare workers, first responders, and essential workers. These efforts would not be possible without the incredible help and partnership of our local health departments, our advanced practice nurses who have volunteered across the state, and also our Indiana National Guard. Thank you all so much for your partnerships in this endeavor. We're going to need you even more in the coming days. As of last night, 41% of our ICU beds were available. Of those ICU beds that were in use, 28% were COVID-related and 31% were non-COVID, and that number has stayed pretty consistent. Also, 69% of our ventilators were available. Of the ventilators in use, 18% were for COVID-related patients and 13% for non-COVID-related patients. We'll also be adding these numbers to our dashboard next week for you to follow on a daily basis. I want to take a moment to reiterate how challenging it is to capture data every 24 hours on a real-time basis when we are getting these numbers updated throughout the day. They fluctuate sometimes hourly. Normally, with something like influenza, we'll post that data on a weekly basis, giving us time to verify the data, remove duplicates, and ensure that all of the data has been reported within that time period. But this is an unprecedented situation, and we're working to bring you data as quickly as possible. But what that means is that our data is subject to change. You can't have it quickly and ensure that it's 100% accurate and complete. So you will continue to see us remove duplicates or shift counties of residence as we clean the data up on the back end. This is the reality of reporting information in a live event. As I said, we'll be adding much of this data to our dashboard on Monday. Because of these rapidly moving figures, we're also moving our dashboard updates to noon to allow for more time to capture the most current data. I also want to bring you to another update on our status of our volunteer healthcare workers. More than 12,000 people have responded to our volunteer survey. More than 1/3 of IU's School of Medicine graduating class, which actually graduated early, and obtained their scope of practice under Governor Holcomb's emergency order, are already paired with hospitals and ready to work. Every hospital that has requested a student, be it a nursing or a medical student, has received one. But we're actually going on the back end now and doing another survey to find out if there are volunteers out there that have not been partnered with a hospital, long-term care facility, dialysis unit, whatever that is, that we can find those individuals and make sure that we help to connect them. Hospitals are being matched with volunteers in their area. And again, we will be checking to see if individuals do not get matched with a particular hospital or facility, if we can match them elsewhere. I'm absolutely grateful and incredibly very happy that the Bowen Center has helped us with this. Thank you very much.
Thank you, Dr. Box. A lot of numbers. Encouraging to see 12,000 Hoosiers step forward and volunteer, but when you talk about the 41% ICU beds available, the 69% vents available, I don't want anyone to be misled. This is when we talk about preparing for the surge, which is what we're doing right now in every way. we're really talking about the potential run on our resources. So we're planning daily, hourly, responding, as you say, in real time in 92 counties to a pandemic. And we're going to be safe, not sorry. And our goal, whether it's on the health front or on the safety front or on the economic front, is to be one of the first in this storm and one of the first out. And a key part of that whole effort is going to be standing up in the reentry of our workforce. And Chris, maybe from a budget perspective, from the OMB perspective, if you would just give us an update on where we are fiscally speaking, and then maybe turn it over to Secretary Schellinger to give us a perspective on what's all been happening for the last few weeks as we look forward, the next month and beyond, as we're hopefully and planning to come out of this.
I will. Thank you, and good afternoon. Earlier this week, I provided some brief comments regarding our March revenues. The report and the commentary that goes along with that report were posted earlier today. And we have a graph of the fiscal year 2020 revenues, of which I'd like to take a minute to walk through those numbers. There's a lot of numbers and detail on there. Each month, starting in June through March, you'll see two bars. The darker blue bar on the left side is the estimate from the most recent revenue forecast. The bar on the right, the lighter blue, are the actual collections. The axis on the left shows you the total dollar amount of those collections. The axis on the right shows the difference between the estimate and the actual collections, and the gray line shows that percentage difference. As you can see, most months through February exceeded estimate. If you added up all of those variances, that would total $100 million, that through February we exceeded our forecast by $100 million. But in March, you'll see we've had our first significant difference, an erosion of 6%. The dollar amount is $70 million, so that $100 million has been reduced to about $33 million compared to forecast. Our revenues missed their estimate across all major categories, and as I noted earlier, the closure of the casinos for 1 week of this reporting period was a significant factor. But what I'd like to point out on this graph are the three remaining single bars in April, May, and June. As you can see, April and June have generally been and continue to be our largest revenue months. We know that's not going to be the case this year. Income tax day has been moved back to July 15th, and while that sounds just like a timing difference, it's going to put significant pressure on our budget through the rest of this fiscal year. What will show up starting in April's numbers are signs of all the things that we are having to do, necessary steps to fight the public health emergency, will show up in those sales tax and income tax numbers. We do know that the descent will be steep and rapid. What we don't know for sure is what the pace of the recovery will be. This will present challenges not only to the current budget, but future budgets in order for us to deliver to the best of our ability our priority services that we've committed to our Hoosiers, and we are taking steps to prepare for that. As you've heard in each day in these briefings, we have to all be diligent in our collective mission to fight and defeat COVID-19. To do so, we have rightly had to change our behavior, both in our individual lives and in the business community. After fighting through and managing this public health crisis, we want to turn to our federal assistance. You may have heard about federal assistance coming to the states. I want to talk a little bit about deploying that federal assistance before I turn it over to Secretary Schellinger, who's going to talk about our return to economic activity, adapting our government and business operations to a post-COVID-19 world, and using what we've learned to change the way we do business in the future. Excuse me again. There have been 3 packages of COVID-19 funding approved by the federal government. The first was adopted on March 6th, the Coronavirus Preparedness and Response Supplemental Appropriations Act. The second was the Family First Coronavirus Response Act, and that was adopted on March 18th. And finally, on March 27th, the Coronavirus Aid, Relief, and Economic Securities Act, or CARES, was adopted on March 27th. I'd like to go through each of these one at a time. The first package, the Preparedness and Response Act, was primarily and very targeted to our Department of Health. It was for public health preparedness. It was approximately $10.6 million, and it was really driven towards buying personal protective equipment. The second installment, the Families First Coronavirus Response Act, dealt really with providing assistance to individuals. It was food and nutrition programs. It was easing guidelines for those for SNAP and women and infant and children programs. There was also unemployment insurance, expanding not only those contributions, but then also the administrative costs for providing those services. There was emergency sick and family medical leave, which has provided flexibility for employees impacted by COVID-19. And then there are also certain health provisions, which included the increase in the federal sharing of our eligible Medicaid expenses. I have not put any dollar amounts or estimates on this particular package because it is really driving to the individual. Finally, the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act. It is anticipated that the state will receive over $3 billion related to this package. $250 million are for existing programs, grant programs that the state already administers. I want to say that I'm speaking in terms of very round terms, round numbers, because these are estimates that have come out from various sources, and the state and local governments will really not know what the actual dollar amount is until the federal awards come out. But the $250 million for existing programs range across several different program areas. Health and Human Services will direct funding to FSSA for the Child Care Development Block Grant and DCS for Child Welfare Services. As we've heard from Fred Payne at the Department of Workforce Development, the Department of Labor is providing funds for unemployment insurance relief and administering those programs. We have the U.S. Department of Agriculture, which is including emergency food programs and the WIC program that I had mentioned. HUD, Housing and Urban Development, will provide additional funding to OCRA, our Office of Community and Rural Affairs, for the Community Development Block Grant Program, and through our Housing and Community Development Authority, additional housing assistance programs. And finally, the Department of Justice will provide justice assistance grants through our Criminal Justice Institute, which really serves as a conduit and pushes that money back out to local jurisdictions. The next component, though, is our two new programs. The first is the Education Stabilization Fund. It's roughly $500 million, which will be allocated among our local education agencies, or K through 12, and our higher education institutions. Most of these funds will be allocated by formula. A small portion of it will be discretionary. The key to all of this is that the guidance from the U.S. Department of Education is still pending. Finally, the last component and largest component is the Coronavirus Relief Fund. The state of Indiana will receive approximately $2.4 billion. It's eligible in the restrictions right now guide how this money can be used. It must be used for costs incurred from March through December of 2020 that are necessary expenditures incurred due to the public health emergency. And it can only be used for those purposes, cannot be used for purposes in our biennial budget, or in some people call it revenue replacement. And so we will have, again, waiting the guidance from the U.S. Treasury on this particular program. The federal government has already alerted us to a strict compliance program. This is not uncommon. Back in 2009, during the Recovery Act, there was a very robust Inspector General program about the proper and judicious use of these funds, and we will be prepared to do that. We are setting up our own internal team in order to manage these funds, not only within the Office of Management and Budget, but working with the recipient agencies that will be receiving these funds, as well as their spending programs to send that money out to subrecipients. Finally, two things I would like to point out. We will be conferring with the legislative leadership regarding the use of this program. And then the other thing that I think is important to note is that while it is a sizable amount of money, we also cannot build expectations beyond this funding that we cannot fulfill. And so we will be developing programs and spending programs to monitor and comply with that. At this time, I would like to turn it over to Secretary Schellinger from the Indiana Economic Development Corporation, who's going to talk about additional structure regarding these programs and moving towards the next stages of addressing this crisis.
Thank you, Chris. I would also like to thank the governor, Dr. Box, members of the governor's team, and members, my co-members of the COVID task force for all your leadership and your endless work. As your Secretary of Commerce, I could not be more proud and honored to lead Indiana's economic relief and recovery team with my friend and colleague, Chris Johnston. Together, the two of us, along with some advice from others, we selected 5 people to serve on our advisory committee. I think you'll recognize these names. All 5 are great Americans, great Hoosiers who have a great deal of business experience, but also public service experience. Lieutenant Governor Becky Skillman, former Lieutenant Governor, the first woman ever elected Lieutenant Governor. Senator Luke Kinley, a former Indiana State Senator, 25 years experience. I hesitate to say this too close to Chris, but I was once told that nobody knows the state budget like Senator Luke Kinley, so we're looking forward to his advice and counsel. Al Hubbard is a name a lot of people know around these parts, economic policy advisor and director of National Economic Council, President George W. Bush. Ryan Kitchell, who served many years as the OMB director. And lastly, Kristen Marcaselli, a banker out of the Fort Wayne area and also a board member of IEDC. This team will work hard and we will continue in unison with our legislative leaders, as we always have. We will be working hard with as Chris said, President Pro Tem Rod Bray. We will be working hard with Speaker Todd Houston and both chambers of the General Assembly to make sure that we properly coordinate and do our due diligence with all of these issues we will have to deal with. We will plan, administer, and account for these Indiana relief funds, and we'll do so diligently. We're going to be working on these relief funds for states and local government costs of operation. We'll be working on these relief funds for businesses and then certainly for individuals. We have tracked and will continue to track and monitor the public expenditures, such as state purchases of personal protection and equipment. We've augmented Unemployment Insurance Administration, and recovery and resources directed to the emergency will be covered. How the funds will be distributed locally to local governments and businesses and individual programs has still yet to be defined by the federal government, but as soon as we have those guidance, we will adhere to them accordingly. So as we transition to the next stages here of this group, Chris mentioned some of these already, and I just want to reiterate them because they couldn't be more important. We want to take this to the next level. We want to make sure we get into these next stages, but we want to make sure we're guiding a return to economic activity in a very safe way, full economic recovery activity. We already have lots going on even as we speak in spite of the pandemic. We want to make sure that we're adopting government and business operations adapting to post-COVID-19. And we want to, as Chris said, we want to use what we've learned during this procedure. The executive order by the governor, 2008, issued on March 6th, already lessened the requirements on a number of things for businesses. And as Chris says, we want to look at this, every single detail with our committee, to determine what of those things do we not need really to bring back that can help facilitate business in Indiana. You know, it's 2005 that then Governor Mitch Daniels and his team, which included Governor Holcomb, they decided there was a better way, a new way to do economic development in Indiana, hence the formation of the Indiana Economic Development Corporation, which is now a model across the U.S. You, the Hoosiers, that have created all these businesses, our heart goes out to you. You're the ones that create jobs, not the IDC. You create jobs for Hoosiers across the state, and you have set records in the last 3 years in economic development for wages, for jobs, for Capital X, for payroll, doing outstanding jobs. So we have been reaching out on a regular basis to businesses all across our 92 counties, thousands. We've been reaching out to hundreds of businesses that are headquartered in the other 49 states. And we've certainly been on the phone in the wee hours of the morning talking with representatives from the 38 countries that have businesses here in Indiana. So we've been reaching out. We will continue to reach out and continue to conduct business as normal as we possibly can. Well, we're going to learn new things. We're going to learn from those new things. And you have my word as your Secretary of Commerce that when we get through this to the new norm, we will take Indiana economic development to a new level in a state that works for everyone.
Thank you, Secretary. You are by no means closed. You are open for business, and we're still doing that even during the storm. And appreciate that. Appreciate that, Director Johnston. Another thing, just real quickly before we get to the questions, I know that so much around us seems closed. Even our schools physically seem closed. The classrooms aren't filled with children and teachers and principals and superintendents. But wow, there is so much activity still going on, so much learning going on. And I just wanted to thank both the teachers and the students, and for the support staff, the faculty that's making that happen. Obviously, our schools are more often than not, the center of a community. And our schools are living up to that, even during COVID-19. When you think about the seniors that are missing those teachers and the teachers that are missing their students, the proms that they're missing, or the graduations that are upcoming, we too are thinking post-COVID-19 on special ways to recognize all that has been occurring during this storm. And so I just want to say I appreciate so much how folks have stepped up and filled the void with so much activity that's making a difference, whether that's using Zoom and connecting teachers with, and even my wife, First Lady Janet Holcomb, is connecting with students all over the state of Indiana because of technology, that same technology that's allowing instruction to continue. And we need everyone to run through the tape, and we need everyone to continue to, while we have a handle on our PPE supply, we're never going to be satisfied with the level. We're never going to be satisfied. And so for the schools that are firing up their labs and firing up their 3D printers and helping us make face shields and making yard signs that are put into senior front yards to be able to recognize all that they're going through in this unique circumstance. Thank you, thank you, thank you. I want to also thank DOE and the Indiana Public Broadcasting, PBS, for coming together and putting instruction out there on a daily basis so folks can not just keep up, but to continue to excel. This is going to be hand in glove the most important thing we do. Our economic and our education, when we sail through this from a health perspective, it's all about education and our economy. So with that, we'll go right to the phone lines and answer any question that's on your mind today.
Steve with KPC Media.
Good afternoon, Steve.
Good afternoon, Governor Holcomb. How are you doing today?
Good, thank you.
My question, as usual, will be for Dr. Box and about testing, which is an interest of mine. So I took a long call from a person in Indianapolis today who actually saw one of my stories and thought to talk to me. about her concerns with the availability of testing. She was in her 50s, had some underlying conditions, felt she had been exposed to somebody who had later tested positive for COVID-19 and was struggling and was unable to get a test. So building off of the conversation yesterday, I kind of had a two-parter here. One, it sounded like there was going to be some rollback of some regulations or some red tape to help open up testing a little bit, that maybe since we weren't really fully utilizing our capacity, that there would be some ways to expand that and kind of liberalize providers to test more people. But then also I wanted to just see if you could talk a little bit about the process of building that capacity and why we're talking a matter of weeks to, build up from 4,000 tests to 6,000 tests. What are the limiting factors, and what does it take for Indiana to really increase its capacity to test more people?
Both very, very good questions. With regards to the individual that spoke to you about being exposed to someone who was COVID positive, especially if she was in close contact with that individual for a period of time, she should be in quarantine for 14 days. The risk of testing her, say now or 2 days after the exposure, she could be negative and within a few days be positive, or even within 24 to 48 hours be positive. So I would not recommend testing her right now. With regards to testing, this test is a pretty tedious test as the way it was designed. And I was on a call last night, and we were talking to Admiral Gerard, who is actually taken over the testing. He's the ASH, or the Assistant Secretary for HHS. And it really is it's a pretty tedious test that needs to be done. So we've been very fortunate here in Indiana that, IU has stepped up, Lilly has stepped up, our lab is continuing to do it. I am understanding now that LabCorp is down to about a 48-hour turnaround, that they've gotten their backlog done. So that's going to tremendously help and make it a lot easier for people to test. So someone like the individual you're talking about, if she does develop any symptoms at all, to see her practitioner and could easily be tested that way. I do know that Purdue just passed their initial test that they had to do to show that they were accurately doing their test, and so we will have more testing done through their lab, and they will work up to about 400. But it remains an issue also to get swabs. I was fortunate to be able to have a kind individual donate some swabs today. I'm still working with FEMA to try to get some swabs. We're working in every way possible to use alternative swabs that are out there, and even some new using saline and just a routine cotton Q-tip if we can get our labs to verify that that's successful. So we're working every avenue that I know to increase the testing. I know there's a lot of people that are thinking a lot about immunoglobulin or testing for immunity. And I think it's important to understand when we do a blood test or a serology test, that's not to diagnose that you have COVID-19, but it's that you had COVID-19. It really doesn't tell us anything about the acute disease. And that testing, when it's out and is widespread, will be very, very helpful. Of all the tests that are on the market right now, the FDA has specifically sent us warnings. There's only one that it has an EUA, meaning that they have been approved to do this type of testing. And they're not very confident of the testing there. So I really hesitate to encourage people to do a lot of testing to see if they're immune at this point in time.
Lauren Chapman, Indiana Public Broadcasting.
Hello, Lauren.
Hey, how's it going?
Good. How are you?
Hanging in there.
Good.
Dr. Box, specifically, I'm curious what takeaways we can reasonably gather from the incomplete data of COVID-19 demographics. And is there going to be a point that the public will have a county by county breakdown of that data?
Both very good questions. I think when I looked at other states, and you may look at this too, they're also posting that they're missing significant portions of this data because the data is based on whether somebody checked a box on a lab slip. And many people, as I mentioned yesterday, just check unknown rather than to check that. And when we look at ethnicity, it's even worse with regards to the data. So we're doing things like going back through public health data. We're looking at our birth and death registry data to try to cross-match this, even through Medicaid data, to see if we can get some of that information and make that more complete. Now, as we have data coming out of our hospitals, and we're starting to get that, I'm hoping to be able to talk more about that next week, that data should be more complete with individuals that have been admitted to the hospital and then discharged.
Yeah, so I'd say, Lauren, we're going after that data. The more that we know, the more that informs us on how to address this issue, whether it be disparity or inequity. So we're hot on this trail as well, and that's why we'll continue to be very transparent. When we get that information, you're going to have it.
Rob Burgess, the Wabash Plain Dealer.
Hello, Rob.
Hey, how are you today, Governor?
Good, thank you. How are you?
Oh, I'm great. I'm listening to the Frozen 2 soundtrack for the millionth time with my kids. Question for you or anyone else that wants to take a crack at it.
And you're still great.
Here in Wabash County, like many places, most of those who have filed for unemployment in the past few weeks have been in the manufacturing sector. When these jobs do start to come back, what will you do to help ensure companies don't use this as an opportunity to automate away those jobs instead of hiring those same employees back?
Well, we'll continue to work hand in glove from a regional perspective with them. The first thing that we're going to maintain is our environment of certainty and stability and predictability, continuity, the very assets that when we sailed into this storm separated us from the rest of the pack. That's why when companies are looking at growing their business that's already here or looking to come here from some faraway place, those are the kind of general lures where they know that they can responsibly scale up at their own pace. And so we'll continue to work on a daily basis regionally, again, with those companies. And as they modernize, as they do things differently in the future, we'll have to tailor our workforce development efforts to accommodate. That's what separates us and the talent that Hoosiers provide to these companies to scale up. So we'll continue to be nimble. We'll continue to be agile in the way that we supply a company with the workforce that they need to grow, whether you're in one county or 91 others.
And Governor, if I might add, and the Governor's mentioned this before, Indiana has the most intensive, number one in terms of intensity of manufacturing anywhere in the country. And I think that the CARES Act, $349 billion has been set aside for employers, small and medium employers, to retain their workers. Will have a lot to do with those workers coming back when the time is ready. But we will not be short of any need for those workers, and we hope that our participation rate is better than it was after 2008, 2009. Our labor participation rate, we want to get that back up to 64%.
And I'd also like to add that one of the things that we had been working on even pre-COVID was to make sure that we are putting things in place and training in place and having discussions with employers to address automation, to address AI, and to make sure that we are talking to the right employers and we're having the right educational policies in place and we're having the right training in place so that when automation does come, that our employees and our workers in the state of Indiana are ready for that.
Yeah, and let me just finally, two great points. Another shout out, another thank you to the federal partners in Congress for this CARES Act that Secretary Schellinger just mentioned. The whole purpose of this, and we need to get this right, the whole purpose of this is to make sure that businesses that apply for this SBA loan can maintain their workforce so that their team is on the court when we fire back up. And you're not having to go out and recruit new talent and then teach them. They already know. And so this funding in this case is there for a reason. It's for to have your team in place when everything starts to get turned on again. And so as we incrementally and gradually, very methodically start to open back up, I don't want to get the cart in front of the horse. I know where we are right now. We're looking at the surge, the horizon. But we will sail through this thing. And the states that will separate themselves from the others will be the ones that are moving folks from the sidelines back into the workforce. You can start to do that now. Companies are doing that all over the state of Indiana to have that workforce in place right now. And then as the rest of the global supply chain starts to link back up, we'll already be humming.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Hello, Governor. I was wondering why you, recently a group of 75 doctors sent you a letter about abortions still happening in Indiana. And I wanted to know, why have you not definitively barred abortions during this pandemic?
Well, I have definitively been crystal clear, I think, in our executive order and spelled it out with a long list of what is permissible and what is not. Sharon, you want to comment or elaborate on how anyone could misread the executive order?
Thank you, Governor. Sharon Jackson, Deputy General Counsel. The executive order is crystal clear that all healthcare providers, whether they're hospitals or surgical centers, and including abortion clinics, have been directed to postpone any elective and non-urgent surgical procedure. And what we mean by elective and non-urgent is any procedure that can be postponed without undue risk to the current or future health of the patient. And this is necessarily a medical decision that has to be made by a physician. It's not up to a lawyer or an elected official to say what is an undue risk to the health of a patient. This is a physician's patient. And in those cases where there is a risk to the woman, abortions will be allowed to continue. It has been recognized by the Supreme Court as a constitutional right. It is not something that the state can ban unilaterally in all circumstances. But again, we leave it to the discretion of the physician to make that medical decision as to when it is necessary, and if it is not, it needs to be postponed.
Thank you, Sharon.
Caitlin Lang, the Indianapolis Star.
Good afternoon, Caitlin.
Good afternoon, Governor. 2 questions today. First of all, new research shows that domestic violence has grown worse in Indianapolis as an unintended consequence of the social distancing policies. And yesterday we saw that an IMPD officer was fatally shot while responding to one of those calls. Are you considering any steps to help address domestic violence in the state at this time? Second question, do we have a race breakdown for Marion County for those who have tested positive or who have died from coronavirus?
You want to take the second, and I'll take the first
Correct.
after you? Yeah.
I do not personally have that. I think Dr. Kane has a good idea about that, but I would have to talk with her, and certainly something we could get for you.
Dr. Sullivan, you may want to add to this first question, but I would say, number one, we'll continue to work with local law enforcement, as you know, our state police will continue to in these domestic disputes, as we have in various neighborhoods, various cities, counties across the state of Indiana. We'll continue that practice, but by no means, if you are in an unsafe environment right now, should you remain there, please reach out. We have folks who want to help. We do not want you in harm's way, whether it's during this COVID-19 long experience or was before or come after this. There are people who are willing and wanting to help you get out of that situation. And so I don't want to leave anyone with the impression that there aren't programs going on, whether at FSSA or at the state police, as we partner together. You want to add anything, Dr. Sullivan?
Good afternoon, Jen Sullivan, FSSA Secretary. Part and parcel to this public health and healthcare response is the unintended consequences of those policies on our society at large. The supports that we put in place for mental health are not only for individuals with existing mental health issues, but also the anxieties and concerns that people have in the days and weeks that follow what we're doing now. In addition to that, those stressors that are in place that make risk for domestic violence and child abuse on a regular day are exacerbated during this period. And we must and will continue to work in partnership with communities to make sure that individuals are safe. Please reach out if you have needs, both mental health, both physical danger, emotional danger, and others, to make sure that we can help you at your greatest time of need. We all need to survive this together. Not only our physical health is at stake, but our mental health and the fabric of our families and our societies is at stake as well, and we are here to help you. Thank you.
Yeah, so let me just say this, and I'll repeat it twice. If you are not in a safe place at this moment, please reach out. We want to get you to a safe place. And it could be, the first step could be calling 1-800-799-SAFE, S-A-F-E, 1-800-799-SAFE, SAFE.
Brock Turner, WFIU.
Good afternoon, Brock.
Hi, Governor. Just wanted to ask about sort of what's going on in the southeastern portion of the state. Decatur County has about 65% of positive cases out of the number of cases who have been tested. Franklin County, about 50%. So didn't know if there were any plans to sort of focus efforts in those areas where we're seeing a high concentration of tests coming back positive.
Yeah, most certainly. And we have been in contact with them. We will do the drive-through testing down in Clark County, and probably will come a little bit further north and do it up around Decatur and Ripley also. I will say that they have done more testing per capita there than a lot of places. They sent their labs out. And I do know that they have had a significant number of people in the past in the hospital, but are seeing significant declines now with that. So hopefully that is starting to look better.
Yeah, and I would just add that, and by no means do I go by Dr. Holcomb, but we all know that this COVID-19 does not discriminate, so it's creeping into, it's in 90 of 92 of our counties right now, only 2 remaining. I wouldn't hold my breath if you were in those 2. You're doing great by physically distancing yourselves, so enjoy it while it lasts. I hope it does to the end. But having said that, we also know the community spread is usually seen in the more dense urban areas where where there's a lot of travel in and out, where there's a lot of movement, a lot of folks bumping up against each other. So that's why if you turn on the national news and you see Chicago and New York City and Detroit, and we're not immune to that either. So Indianapolis, and when you look at Chicago up that borders us, or Cincinnati or Louisville, these are the areas that sometimes you see that spread trickle. So we'll continue to address it in all of our 92 counties. But when you ask what is going on, it could be a long list of what is going on that's different in, Pulaski County and Ripley County.
Matthew McKinney, WRTV.
Good afternoon.
Matt, you have to unmute your own microphone. There you go.
Sorry about that. My question is about the Education Stabilization Fund. I know you said that it was going to be kind of distributed based on a formula. I was just wondering if that formula has been kind of run yet, and if not, when do you expect that to be run, like kind of the distribution for K-12 versus how much for higher ed here? Thanks.
This is Chris Johnston from OMB, and the formula for K through 12 is going to be based on your relative share of Title I funding. I know that's a very technical answer, but right now, the federal funds through Title I that go out, come through the Department of Education, through the local school corporations, it'll be the same relative share of that funding source. As far as the higher ed component, that has its own formula that's going to be based off of the mix of students that have Pell Grants and those students that do not. Other than that, there'll be additional guidance that comes out from the U.S. Department of Education.
Elizabeth, PBS, Michiana.
Good afternoon, Elizabeth.
Good afternoon, Governor. We had a viewer who's been tuning into all of your daily media briefings, and she's also involved in the State Parks Facebook page, and notes that people are concerned about park workers who are picking up trash and cleaning out pit toilets. She wants to know what, if any, PPE is being provided to these employees, and what the state safety guidelines for these workers are as they maintain Indiana's parks.
Absolutely. And by the way, you teed me up for another point that I want to make, but they are absolutely, because it's an essential duty to keep not just our parks clean, but garbage collection in general. Same true being on state assets. But also, we're going to be very mindful of what is occurring on our state park property this weekend. Could be nice, could be raining, don't know, but we've obviously clamped down on our camping grounds at state parks because we didn't want these to be magnets. They're so beautiful, and it's probably luring and attractive to go out to one of the state parks, but we have said that's not what this is for. The state parks were for, folks living in neighboring counties to go exercise. I always say stay home, stay healthy, and stay connected, and that stay healthy part is running around the block or walking your dog or cat or going to a state park and going for a hike, but then going home, properly, physically, socially distanced. If we'll have our conservation officers, et cetera, and our state personnel at our parks, obviously not just collecting trash, but doing a whole lot more than that to make sure that they're up to par. But we'll also be monitoring the traffic counts there. And if we have too many people in one confined area, then we're going to just have to take appropriate action come Monday.
Ken from the Associated Press.
Good afternoon, Ken.
Good afternoon. I have a question for Dr. Box regarding Bethany Point. How current, the numbers you gave earlier, I believe you mentioned 24 residents at Bethany Point have died, 16 who had COVID-19 and 8 who showed symptoms. My questions are, how current are those numbers? How many other residents there have tested positive for COVID-19? And how many who have tested positive are, how many are hospitalized? Thank you.
So I'm going to let Dr. Dan come up and answer some of that to the best of our ability. I will say that the individuals that had the symptoms and were in close contact with other individuals that were known COVID positive, we consider those COVID deaths. They are up to date as of right before we came over here today. So our deaths today will not reflect all of those. As for the other numbers, Dan, I might see if you have more.
Yeah, we, since the first contact, we've tested every person in that facility. The last batch we did was earlier in this week, and on that one we tested an additional 54 persons, of which 23 at that time were positive. In terms of, I don't know the exact numbers right now as to how many folks are currently in the hospital and how many are still in that facility, but that's information that we can find.
Lindsay Ardoti, the Indianapolis Business Journal.
Hello, Lindsay.
Good afternoon, Governor. I was wondering, given the monthly revenue report that came out today and showing missing the forecast by so much, does the state need a new revenue forecast? And if so, when are you looking at doing that?
Well, we are looking at it. The exact timing, I think, is going to be worked out with the leadership of the General Assembly. Because of what we're fearing in the next couple of months, I think that data is going to be important to incorporate in whatever finalized modeling we have to do. And so that I would expect probably in the middle of the summer in anticipation of building the next year's budget.
Michael Puente, WBEZ.
Afternoon, Michael.
Oh, thank you, Governor, and thank you, Dr. Box, for taking my question. And really got to commend both of you and your staff for being out in front for the press to ask questions. Now, I think 3 weeks in a row, so, thank you for that. My question is, I have two questions for Dr. Box. The figure you shared earlier, that 19% of COVID-19 deaths in Indiana are African American, is that figure higher or lower than what you were expecting? And number two is, us in the press, we've been accused of not sharing good news, to the public, either about recovery or survival rates. Are there any positive trends you're seeing right now in any aspect of this COVID-19 pandemic that we can report? Sorry to put you on the spot.
That's a really good question. Yes, I expected the number of African American deaths to be a higher percentage than the number of African Americans represented in our state population overall. And that is because that's what every other state has seen, and that is because they have higher incidence, as I mentioned, of some of those comorbidities that are more likely to contribute to a death from COVID-19, like heart disease and diabetes. When I look at positive things, I see positive things every day because people are so kind to come and put chalk drawings on my driveway or send flowers or notes and just encourage. So that has been incredibly uplifting for me. I see positive things in that we are very prepared as a state. I have never seen healthcare systems and long-term care facilities, along with healthcare systems, state agencies, and external agencies work together the way I have seen come together for this pandemic. It's hard when we have this many people dying to be real positive. But I know that we are going to do everything, and we are doing everything that we can to dampen the number of lives that we lose in the state of Indiana. And I know that we've got a great Hoosier population that is doing a lot to take care of each other.
Yeah, and I would just say the same and keep. You can do both. You can, and by the way, probably have an obligation to share the facts. Hoosiers are tough. We need the truth. We can handle the truth, and that's how we'll respond to this. That's why I'm so darn proud of the way Hoosiers have responded. We are making a difference every single day. We saw this thing about 2 weeks early. We got in, jumped in feet first, and said, we're coming at this, and we're going to get in it quick, and we're going to get out as quick as humanly possible. That means all of us, and that means staying safe right now, and unfortunately that means staying home. But we're going to minimize this, and I would say on the other hand, to your point, I so appreciate the good news that you do share, because it's infectious in its own way. It spreads. I get calls. We're going to have a really good Monday report, because we're going to be able to show you in terms of PPE, in terms of our procurement efforts, all that we've been able to do going out all over the state, all over the country, people responding, people that have never stepped foot in the state of Indiana, saying, how can we help? You guys are on the right track. You guys are taking this head on. We want to contribute. And you're going to see an outpouring of not just generosity, but folks who are making a difference, who are actually saving lives. And everyone that we lose, it is tough stuff. But we're going to make a huge difference because we all are in this together.
Eric Berman, WIBC.
Hello, Eric.
Hello, Governor. Happy Easter.
You as well.
Quick question for Secretary Schellinger. You alluded in your remarks earlier to the calls you're making to the businesses who in better times would be preparing to locate here. This obviously isn't an Indiana problem. This is a global problem. What are they telling you in terms of what they're looking at when they'll be ready to make expansion or location decisions anywhere, much less here?
Thank you. I appreciate the question, Eric. We still, as the governor alluded to earlier, we have not shut down for business. And this year, we've already got over 8,500 job commitments to the state of Indiana. 81 different businesses have provided us with that. And it involves a CapEx of $1.2 billion. So if you track back to record year 17, record year 18, record year 19, we are right on track for that. And it's mainly because businesses have such a longer time span to making decisions. We have people making decisions today where their business won't open for 2.5, 3 years. So I would say that we think the structure we have in place is going to speed up the recovery when time comes. But in spite of that, we're in touch with those people every day. Some are saying they're going to wait a few weeks to make a decision because their staff is at home and they want to do it in person. But we've got over 62 projects in the pipeline representing over 11,000 jobs. So we remain strong as a state and we'll continue to work that effort.
And we'll continue to protect our very attractive, rational, and reasonable tax and regulatory environment. The world will wake up again. We will all rise again. And folks are going to make investment decisions based on that. And during this fog of war that we're all finding our way through, we're going to continue to keep not just our wits about us, but we're going to continue to keep what makes us a special place to grow.
Our last question is from Kayla Sullivan, Box 59.
Hello, Kayla. Good afternoon.
Good afternoon, Governor. And as we head into Easter weekend, I feel like the state did a really good job of providing guidelines for people, staying away from extended family members, what churches need to be doing. But as we know, unfortunately, there's always the bad apples. So are people encouraged to report those people? I mean, if I see a large gathering at my neighbor's house, or if I see a church disobeying this, are we encouraged to report it? And if so, who do we report it to?
Yeah, well, I mean, we work for you, the public. This is our job. And it's one that I bet all of us would do just if asked free. So yes, we need more information. That's why all of those 214 complaints, we followed up on every single one of them. It's not because we, want to kick in someone's door. It's because we want to keep you safe. We want your business to grow after this. And you're right, one bad apple can spoil a bushel. And in this example, it means lives. It means a whole congregation getting sick. It means a whole classroom getting sick. It means a whole factory line getting sick. And so we're first begging, pleading, asking politely to play along, to play by the rules, to get with the program, as I said a few days ago. And that's the way we're going to get through this with our health still intact.
Thank you for joining Governor Holcomb's briefing. A media advisory will be sent with details regarding the next briefing.